Did you know there is a reason why buried emotions and trauma surfaces more during menopause than at other times in our life? Welcome to this episode of the Biology of Trauma podcast. I'm your host, Dr. Aimie, and we're exploring the intersection of Chinese medicine and stored trauma in the body for the science and practice of healing in yourself or for those that you help. Today, I'm joined by my good friend and colleague, Dr. Lorne Brown. He's a longtime practitioner of Chinese medicine, and his way of understanding stored trauma lines up beautifully with what I teach about the nervous system and chronic functional freeze. So we decided to teach on this, and we talk about why the body holds overwhelming experiences in layers, and why that strategy works for a long time until it doesn't, and why that begins to unravel around menopause. If you are interested in the relationship of perimenopause and the surfacing of buried emotions, this conversation will give you a new way to understand what is happening in your body. If this topic is feeling too advanced for you, no worries. Episode 23 is a good place to start as it lays the foundation for what is the parasympathetic state and why does it matter for the healing journey. Let's dive in. I am very excited for this session and really this interview. And so what we're going to do is we're going to go right into it because I've got a lot of questions and this will be my turn to learn because there's so much about this topic that I don't know actually. And I'm super curious and want to know. Chinese medicine may help explain why stored trauma causes old patterns to resurface when we least expect it and give us deeper insights into the freeze response, chronic dysregulation, and why change is harder for the body when it is carrying buried trauma. Here with me today is Dr. Lorne Brown. And after a few conversations now, I wanted to bring him on because I have questions and I'm coming with that learner's curiosity mind today. Dr. Lorne Brown is a recognized leader in integrative, reproductive, and hormone health. Starting his career, though, as an accountant, he brings the analytics to his work as the founder of AcuBalance Wellness Center, where he introduced IVF acupuncture to Vancouver clinics in 2002. Dr. Brown is the author of the AcuBalance Fertility Diet and the AcuBalance Longevity Diet for Perimenopause and Menopause, and the host of his own podcast, the Conscious Fertility Podcast. This is where he had me on as a guest to talk about my book, The Biology of Trauma. And so as we look at this topic, and I have incorporated Chinese medicine into my own regular maintenance protocol for health, for my own balance and harmony, getting regular acupuncture, for example, among a few other things. But I have done this knowing the value of it because I can feel the difference, but not understanding it. So as we are diving into this today, I want to start with the question for me, which is from a traditional Chinese medicine perspective, how do you understand trauma stored in the body?
I'm going to see if I can blur my background because I wanted to show everybody what I have beside me here, your book. So thank you for writing this book, The Biology of Trauma. I appreciate this book and I share it with my patients and clients all the time. And I really enjoyed our conversation too on the Conscious for Fertility and Beyond podcast. So Chinese medicine and trauma, let's talk about this. And as I was reading your book, I was like, is she trained in Chinese medicine? Because there was so much alignment and it resonated so well. I guess it's first fair to start with just that our body is the terrain, and then there's different maps of that terrain. Western medicine has a map, Ayurvedic has a map, Chinese medicine has a map. We're learning through trauma work, quantum physics has a map. And so we're always speaking of the same terrain, but we may have a different lens on when we describe it. And so you'll see a lot of similarities of what you've shared in your book and through your own experience. But I will start with that when we have an emotional overwhelm, when an event happens, and as you talk about in your book, you're well aware, and hopefully your audience, that it's not always the situation that causes the experience inside, it's how you perceive it. In Chinese medicine, it's all about qi flow. And it's all about self-preservation. So when you have a emotionally overwhelming event, the body's job is to keep you safe. It's to survive. And what it does is it stores it on purpose. So this is not a fault in the body. This is a brilliant survival mechanism. So how Chinese medicine understands it, is there's layers, and there's three main layers we often talk about, and then there's the channel systems as well, that it doesn't want this energy, this strong energy, call it anger, call it fear, call it shame. It doesn't want it to reach the organs, because that's where serious diseases happen. So the Wei Qi, the most superficial level, its first defense is let's keep it out. That's including viruses and pathogens, but also emotions. And so it will start to store it that way, superficially. And then if it gets past that, it goes more into the blood circulation issue. So the first level, you may start to feel neck tension or tightness in the shoulders. We start to notice this as a little bit of a sympathetic overdrive. If it goes deeper into the blood and circulation level, we may start to notice it IBS in migraines and insomnia. And if it gets really deep into the organ level, we start to develop autoimmune diseases. And so you talk about this in your book, but in Chinese medicine, that neck tension or that headache and IBS is messages from the body. And it's also the body saying, we need to store this somewhere because we don't want it to go to the vital organs. And when we're children, we don't have the capacity to process and metabolize these strong emotions. But as we get older, the body eventually says, you need to deal with this. And what I observed in my practice, so at the time of our recording, I'm almost in my 26th year. I'm at the end of my 25 years of practice. And I started noticing somewhere around 40, age 40, plus or minus 5 years, and this is a generalization, a lot of the people I would see started noticing that the things that they tried that would work for their IBS, their headaches, their insomnia, all of a sudden it stopped working. It may work for 2 weeks or for 2 hours, or it would go away and then something else would show up, another weird symptom would show up. And this became my kind of aha moment that how I interpret this is this stuck, we use the word trauma and some people use it loosely. I'm going to call this stuck energy, but it's this trauma in the cells, this stuck energy in the cells, in the tissues, in the channel system in Chinese medicine. Through self-preservation, it takes a lot of energy, a lot of resources to keep that packed in the cells, to keep it away. But as we get older, self-preservation, the body's, I can't waste resources dealing with this anymore because we need our resources for longevity to live long. And we don't have youth on our side anymore because we do die eventually. Even in Chinese medicine, an average age is supposed to be 120. That's what the body's supposed to last, 120 years. And so in its wisdom, it's you need to deal with this. And so all of a sudden, these issues start to come up. And it's time for you to now metabolize and process it because the body is, you're not 6 anymore. You're not 4 anymore. You are an adult and we now have to release this. It's time to deal with our work. We have to do our conscious work. So that was my interpretation is when we're young, 20, 25, it just seems like either you didn't notice it or you could do something, take your pill for it, take an acupuncture, an herb, supplements, and you're good for a while. Somewhere around 40, those things don't seem to work so well. And then post-COVID, due to the isolation, more trauma to us, because we're not meant to be isolated, we're communities, we're community-type animals. And I suspect, I don't have research on this, so this is just my observation, so this is a Lorne Brown opinion. I think from that spike protein, the extra inflammation in the body become a perfect storm. So now we have even less capacity to deal with our stuff, and more people are finding they're just having issues. There's like a collective awakening. So with the isolation, with the inflammation from either the vaccine or the COVID virus, it seemed to, and then add my patient population, perimenopause and menopause, it just seems like it's a massive wake-up call and everybody's being called to do their work.
So in the biology of trauma, I talk about how we develop a state of chronic functional freeze. Yes. It makes us stuck and we adapt, we compensate because that's what the body does so well for this self-preservation. Is there any coincidence that this ability to compensate and adapt starts to fall apart during the time when hormones begin to change with perimenopause and then menopause?
Yeah, no, it makes total sense to me, and I see it on my table every day for a couple of reasons. One is we're just growth, like we peak, right? Somewhere around 28, we're peak. In Chinese medicine, we age in cycles of 7. So you're peaking in that 21 to 28-year-old age. And then every 7 years, there's a decline in Chinese medicine. At 42, or even at 49, we say the Ren in Chengma is empty. That means you're not supposed to be able to conceive anymore at 49, and your periods will stop. So pretty close. We know average age is 51. So at 7 times 5 is 35. The yang ming becomes deficient. So how does that show up in the body? We start to have less digestive fire. The yang ming's connected to digestion. So all of a sudden, those foods you could eat as a 12-year-old, 15, you can't. Our skin starts to wrinkle a bit. We start to get a little bit of gray hair. That's all part of where the system, it's all natural aging. And we, as we age, are going to lose some capacity regardless. So we're going to, like, at 75, you're not going to be able to run a marathon. You can run a marathon. I'm going to compare you to your 21-year-old. The 75 version of me cannot compete with the 21-year version of me. So just with capacity, we lose bone mass, we lose muscle mass. It's just part of, and when we die at 120, we're a little bit skinnier, right? We become a little bit frailer. So it's part of life. So when you go into perimenopause and menopause, there is a very physical level and a spiritual level from Chinese medicine to look at this. On the physical level, your hormones are fluctuating. This is a normal transition. It's supposed to happen. It's not a disease, menopause, perimenopause. It'd be like calling puberty a disease. Now, if you have a teenage daughter in your house, maybe you feel like it is a disease. But perimenopause is just you're in your 40s. Menopause is you haven't had a period for a year. And what's happening is the estrogen is fluctuating in perimenopause and the progesterone is declining, and then both are in decline in menopause. If it was because of those hormones, then every single woman would suffer with menopause and every single woman would have these same symptoms. But we actually know not every woman struggles through menopause and they don't have all the same symptoms. So the hormone fluctuation is change internally. And if you don't have the resilience and capacity to adapt to the change, you will feel these experiences in your body because your window of tolerance has shrunken based on age. And now you have these hormone changes. So in my practice, I work on not just helping balance the hormones to help relieve the symptoms, of course, because that is the trigger. I'm working on the underlying capacity for the body to adapt and have resilience. Because if we don't address the root cause, which is the root cause, when that woman is 70, because she doesn't have the capacity of resilience, new disease issues will happen at 70. So just like when you have change outside in the world, change in job, work, relationships, that's a form of external stressor which could cause a stress response. Your hormones fluctuating is internal stress. And if you have the capacity, you won't even notice it. But if you don't have the capacity, hello night sweats, hello hot flashes, hello brain fog, hello vaginal dryness, hello all these inflammatory responses that are happening. So it's a perfect storm. And I'll share the spiritual side in Chinese medicine. It's called the second spring. Puberty is your first spring. Menopause is the second spring for women. And it's a time where the resources are diverted from your uterus for reproduction and gets redirected to your heart center, the shin for spirit. And this is a time in a woman's life where she becomes the matriarch for her community, whether you have children or not. You become, and so just physiologically, a woman in menopause has the resources going to her heart center. And again, it's a survival mechanism because it takes a lot of resources to create life and gestate. But when you get into your late 40s and 50s, the body says we need to use that energy so we can live long and live well long versus trying to have resources to children. And so often it's a new awakening for the woman, and every hot flash is like karma being burnt off.
That gives me a visual. And that is one of the most beautiful things that I've been told about menopause and this diversion of resources to the heart center. I am going to spend some time reflecting on that. Now, I really want to dig deeper into understanding this idea of the chi and stagnation of chi, because even you use the word stuck and helping people get unstuck quite a bit. And given your understanding of this trauma response and the chronic functional freeze that gets embedded into us so that our body and our biology is in this pattern of protection instead of a pattern of connection, what is the understanding? What is the language of Chinese medicine and this chi stagnation that would explain a chronic functional freeze?
Sure. So in Chinese medicine, the general concept is when there's qi flow, there's health. And when the qi does not flow freely and smoothly, we get pain and disease manifest. And the number one cause of diseases, according to our textbooks, classic textbooks in Chinese medicine, are the emotions in disharmony, so major overwhelm, or chronic disharmony, like over a long period of time. It's more than the wrong, so they also have like error by doctor, more than cause from the external pathogens, more than wrong prescription of herbs and treatment, more from accidents. The number one cause of disease is the emotions in Chinese medicine. That's why we don't call it mind and body, we call it mind body. You can't separate them. Like literally it's mind body. Don't even use the word and inside of mind and body, because it's bidirectional. Your thoughts and feelings impact your physical, and your physical impacts your thoughts and feelings. It's bidirectional. So life is all about circulation and flow. To put this into kind of conscious talk, my background, clinical hypnotherapist, and I do a lot of conscious work, resistance. When you fight with reality, when you fight with what is, you create resistance. Resistance is stagnation. And so if you're able to accept what is, and accepting what is doesn't mean you're resigned to it, it doesn't mean you like it, it just means you're literally accepting that this is how I feel now. It's a form of self-love. It's being authentic. You stop amplifying the uncomfortable feeling. So when life happens to you, a situation happens, and it creates a reaction inside of you, if you suppress it, if you depress it, push it away, or even project it out, it gets stuck in your tissues. It's chi stagnation. If you have that feeling, somebody cuts me off on the way to work, it scares me and I'm angry and I drop a few F-bombs, and a minute later, it's moved through me and I'm fine, that's a human experience, no stagnation. If 2 days later, Amy, I talk to you and I'm still talking about that driver who cut me off, and I'm looking up how I can find his license plate because I want to egg his car, that's a stagnation. So it's not about that you don't feel your emotions. You get to feel sadness. You get the whole human experience. It's that it moves through you. It moves through you. And so it's like a song, a bad song on the radio. The radio does not confuse itself as the bad song. The song plays, and if you just wait it out, sit with it, it will move through you. And then another song comes on. Or if you're proactive, so the work I use in my clinic, the tools you share in your book, you can change the dial of the radio and get a new song. You don't have to wait it out. But if you complain about the song and depress it and suppress it, it's like hitting repeat. And you keep getting that song over and over. So every time you have a life happens and it bumps up against your stuck energy, it activates it. So that's why somebody will do something. They're the trigger. They're not responsible for how you feel. Only you are. They may be the trigger, but you had to have anger inside of you for it to be activated. And now it's an opportunity for you to finally release it, to let it go, move through you. And if it does, that's chi flow. It has very minimal to no health consequences. It's only when you cause stagnation by fighting with it, repressing it, pushing away, projecting it out.
And yet this is exactly what I did for most of my life with my own freeze response. I resisted it. I hated it. I did not want to accept it. I did not want to feel it. I did not want to allow it. And yet it was always there. It's always in the background. It was always waiting for me, especially when I got home. It was like that person that won't leave you alone with their text messages. Just like, I'm here and I'm still here. And this is why I'm being reminded of why I love to geek out about these things with you, because it's true. Like, we're talking the same language around this acceptance of my current capacity, taking responsibility for growing my capacity. And yet I can't grow my capacity without accepting my current capacity.
Yes, because when you can't accept it, and I have a process I call notice, accept, choose again. So you do get to take action. We're not saying you're passive. We're not saying you're resigned to it. You're not a doormat. But the first step is to metabolize these uncomfortable feelings in these old programs. And they, as a child, they kept you alive. So they worked. You're alive. But now the body's, we got to deal with it. We've matured and we got to develop capacity, tolerance, tools. And we haven't dealt with it for a couple of reasons. Again, my opinion. One is we're told that we shouldn't feel sad or any of these emotions. We're always supposed to be happy. If I'm not feeling good, I need a pill, right? So we just culturally think we shouldn't feel these feelings. So we're already culturally suppressing them, pushing them away, because we don't even know how to sit with sadness or shame or guilt. So that would be, to me, one of the main reasons. And then the second reason is you have to be willing to feel uncomfortable. To accept these feelings means you actually activate them, to have the neuroplasticity, to have the shift. the feeling gets activated, and you bring that witness consciousness around to accept it, to notice it. That's how you accept it. You observe it, you notice it without judgment, without analyzing it. And that's uncomfortable because you're feeling those uncomfortable feelings. However, in this process, in NAC, notice, accept, choose again, if you're able to sit with it and be willing to be uncomfortable, just like that song that takes a minute and a half to play through the radio, within a minute and a half, there's usually a sense of relief and freedom comes. That means the resistance drops. See, when the first feeling comes up, there's a part of me that's like, I don't like this. Here's guilt or here's sadness. I don't like this. If I keep breathing in for 4, hold for 4, out for 8, I'm telling my nervous system I'm safe, because as soon as that feeling comes up, my reaction, autonomic nervous system, is I'm not safe, and it goes into fight, flight, or freeze. And so I'm participating, saying, okay, I'm telling, because the mind forgets, the body remembers. I know I'm okay, but my body's, I don't like this feeling. I remember this from 4 somewhere unconsciously. This is not a good feeling. And I'm using my breath to say, I got this. Stay, autonomic nervous system, we're okay. Let's not go into full overwhelmed sympathetic high beta. And then I start to relax into it. I let my shoulders drop. I breathe into it. I allow it. I use other tools. I'll bring in EFT. I'll bring in whole brain gym. I'll bring in inner child. I'll bring Byron Katie inquiry. I'll bring any tool into the accepting to help me be present with the uncomfortable feeling, because that uncomfortable feeling will act as a portal to presence. And what you're doing is, by practicing observing it, you literally are tuning into the witness consciousness. And that is what does the metabolism of those uncomfortable feelings. That, I believe, your higher self does that, but you don't have to believe in that. The mere fact of just observing it takes the resistance down, because when you have a feeling and you try not to feel it, you amplify it. There's your stagnation. You add to it. But if you have a feeling and you can spend a minute to 2 minutes being with it, without every time you start to think, come back to feeling, because it's not you can't think your way through it. It's a felt sense experience. You have to feel it to heal it. And if you resist, it persists. We all know those sayings. And so as you breathe in and lean into these uncomfortable feelings, and again, I like a couple of tools to help, the resistance drops. When there's resistance drops, there's a sense of relief. And now flow and receptivity comes through you. Now we have chi flow again, no longer chi stagnation. You get out of the reptilian vein, out of the sympathetic fight or flight. Now you got more parasympathetic. You're now able to access whole brain, and often an inspired thought comes through you, which then can lead to inspired action.
So I had a conversation with a woman the other day, and we'll call her Melinda. And she had processed a lot of the emotional experiences that she had with her mother that not were just from her childhood, but even then becoming her caretaker. And then her mother passed away. She thought she had resolved all of that. She thought she was good. And at that time, she had some chronic, latent, like viral infection symptoms that had lingered, creating a version of chronic fatigue syndrome. But it had all cleared up after her mother had passed, and she felt, I've healed this. And then perimenopause hit. And she's, what is this? Her body was back not only in those chronic fatigue symptoms, but she was having thoughts, and she was having memories, and she was having anger surfacing that she thought she had fully resolved. So through your lens, can you explain that to me?
The best I can, because I'm definitely not enlightened yet, but I'll do my best to explain it. One is, perimenopause is like an inflammatory state. Just like premenstrually, it's a naturally inflammatory. So it can aggravate a lot of symptoms that you have, because you're just inflammatory. The hormones are fluctuating. It's a stress to the body. A stress to the body adds more inflammation. So just on a physical level, if your hormones are fluctuating, you do have a lower window of tolerance. And if somebody has a really good window of tolerance, so they have good resilience and they're able to adapt or have no symptoms, because their resilience is generous, that even though it's shrunk compared to what it was before, they don't notice it because it's still adequate to have the capacity to adapt. But if you're on that tipping scale and you're pretty good, but if you don't sleep for 2 nights, you're not good, or you have a fight with a relationship, then you're like good and not good, because you're right at the tipping point. Perimenopause comes, it shrinks your tolerance, so now you're no longer in the capacity to adapt. You just lost it. And so it's just a message to me from the body, like, we have work to do. No blame, just this is what it is. From your specific case, for me, for my own personal life and with my patients, I don't get too much into the why or how come. I get out of the head these days. And the fact that I'm experiencing a feeling and a memory and a feeling is all I need to know, that it's my responsibility and accountability to work it. How do you know you're done working it? Because it doesn't show up anymore. If I'm 88 and I've still got to work on shame, then I still got to work on shame. It's just because it's there. That's how I know. There's nothing to discuss. I don't know why. Some people, one session it's gone, and some people, they work it the rest of their lives. What I do know is when it comes up, shame, for example, for me, it used to be a big one. Now when something triggers it, it's not very often, but when I'm recognizing the shame, I get a little smile because I see this as an opportunity to clean it up. What's happening? I have this NAC process, notice. And in the noticing is don't believe in the story. Don't take it personally. So now that I know I'm triggered, there's a part of me that just knows this is old stuff, remnants. I guess there's some to be worked today. I think of it as a blessing. I have an opportunity to clean up this system. So I have more flow going through me. So I'm grateful. It comes up. I don't take it personally. I'm experiencing it, but I'm pretty immediate at witnessing it at the same time I'm experiencing it, which means I'm not taking it personal, because if I can witness it, then who the heck is witnessing it? I can't be it if I'm witnessing it. And so in this case, when people, like, this is a favorite line on my table is somebody's working with me. Again, I shared a clinical hypnosis sometimes will regress, but they'll say, oh, I've worked this already. I've worked this already. But they're on my table crying about it. So I don't care if you worked it a million times. If it still has a somatic response, that's your message from your body that you get to work it 1,000,001 times.
And this is the exact same thing that I share with people who want to go back to a checklist of events to know if a person has had trauma. And I say, no, it's not about the past. It's not about the events. It's about, is it still showing up in your life, in your relationships, or in your health today? We're looking for one of those patterns of protection. So the pattern of disconnection, pattern of depletion, pattern of disruption of movement, or the stagnation. We're looking for patterns that are still showing up today to know if there's more or deeper work to do.
I agree with you, because I often say, people say, will you regress me, your hypnosis, will you do this? And I go, we don't need to go look in the past. Let's just talk about what happened this week, because life bounced up against it. And of course, I will regress, but I'm not one of those practitioners that tries to look for early trauma. I do ask, just like when. That's all I do. When I used to do full-on hypnosis before I developed my process, I would really try to regress and find that early wounding. Now it always comes up. I just ask, just like when, and a memory pops up, and so we work it. We do the inner child work, we work it. But we're no longer fixated on the trigger, whether it was something that happened at 4 or something that your partner said today or something that happened at work. We just want to know, how did you react to it? And it's a reaction. There's the Viktor Frankl quote that I play with, where he says, in every situation, there's a moment you either unconsciously react or consciously respond. And that unconscious reaction is through the lens of your subconscious program that got imprinted. And I say NAC, this notice accept, is a way to interrupt the story so you can consciously respond to it. And respond from presence, not from fear and lack, but from being whole and complete. And then you have that flow and receptivity, and that's where right action follows right beingness or right thinking.
So let's talk about that and how that works through the Chinese medicine lens. As I talk about in the biology of trauma, to change those patterns of response, to change those patterns, I have to create the safety to allow myself, my nervous system, my body to make a different choice. Otherwise, it won't feel safe to do anything different than what has needed to stay alive and preserve itself up until now. So safety, and when I talk about safety, I'm talking about all the way from creating that mental state of safety by putting the distance between me and a thought, like you've talked about, talking about somatic sense, that felt sense of safety. And I'm talking about biological safety. So a biology of safety, which I love your NAC, because NAC is one of my favorite supplements. And creating that biology of safety when I've got the brain fog. And for me, that came from multiple head injuries over my lifetime. But this is a big symptom that people experience, especially in perimenopause with the changes in estrogen. And so I love the NAC as part of my toolkit for creating a biology of safety. Is this the same perspective that Chinese medicine has as the place to start, the foundation that we need for even allowing this stagnation to start to move is creating the safety for it to start to move.
Safety is key, because if you don't have safety, the body contracts. So it's not feeling safe, you go into a form of stagnation. So safety is key, and there's many levels of it. From a Chinese medicine, just from an acupuncture, not even acupuncture, because Qigong can move your Qi, exercise can move your Qi, Tai Chi, your breath, needles. So the reason acupuncture sometimes, for many, not all, but for many, is a great way to release these emotions is it creates motion. It's creating Qi flow. And a body that has circulation has more capacity to process the stuck energy, right? So we need the body to move. We need to give it resources. And a perfect example here is many people who are listening may have had an acupuncture session where they're on the table minding their own business, getting acupuncture, and out of nowhere, deep sadness comes or anger, and they just have a cathartic cry, no apparent. What has happened here? Emotion, it's in the name, emotion. Energy in motion, emotion. So emotions are you feeling the flow of Qi in your body. So stuck energy, it feels frustrating and angry, contracted, fear. So the emotions have a Qi quality to it. So when somebody puts information in your body, that's what acupuncture is, by the way. When somebody puts needles into several points, it creates a formula, it creates information for the body to give it movement. And if it's going to move the energy, and emotions are energy in motion, that energy that's been stuck there, call it anger or sadness, just got movement, and now it's been brought to the surface for you to release. So that's a form of why acupuncture can help. And then from the materialistic Newtonian perspective, we studied it, how it releases endorphins. We've seen how it can engage heart rate variability and parasympathetic nervous system. So that's, if you're going into parasympathetic and we're getting a higher HR, the body seems safe. Now, I have to say it's not for everybody. I have some patients that have such a fear of needles that the acupuncture is not giving them a safety experience. Now, nobody loves like getting needles. People love once it's in, but not too many, myself included. My beginnings, I used to be a chartered accountant, a CPA. When I got and received acupuncture, I passed out. I had such a fear of needles. Now look now I have no problem. But just so you know, as a CPA, I received acupuncture, and I was a tough guy on the table sitting, and they go, "You okay?" And I'm like, "I'm fine." Next thing you know, I flopped over on the table because of the needles. So if somebody can't do it 3 times, because by the 3rd time they're like, "Oh, this isn't a big deal." But if somebody's soaking my sheets out of full-on sweat, out of a fear response, if somebody is really not being able to feel safe on the table, we know in 3 treatments. Look, most people say, "I'm afraid needles and I can't come." That's not enough for me. Try it 3 times. But majority of people will get endorphins, will upregulate the parasympathetic, downregulate the sympathetic, heart rate variability. And that's because we're getting the circulation going, we're moving, and we're calming the flow of Qi, and that feels nice when you have Qi flow. When you don't have Qi flow, it does not feel nice. That's what we call resistance, or what we call stress.
And what would be other tools that Chinese medicine would bring in? Is there light, sound? What are other tools that, according to Chinese medicine, would be promoting that safety for emotion?
So in Chinese medicine, it encompasses it's like saying Western medicine, like Chinese medicine is a theory, it's a thinking, and there's many modalities common to it, but you can bring in other modalities and use them in the principles of Chinese medicine. For example, our herbs all have a flavor and a temperature and energy, right? But we can take Western drugs and say, "Oh, this is their energy." Like, we can look at a drug like Clomid for fertility, or progesterone. Progesterone is a good one because most people know progesterone. Some women on bioidentical progesterone do not do well. They get breakthrough bleeding and they get really irritable and worse. And it's supposed to calm you. They would have often Qi stagnation, depressive heating Chinese medicine. And progesterone is a warming drug. We know it's warming, right? It's an obvious one. You don't even have to understand Chinese medicine to know that. And we look at the pattern, and some drugs don't work well for people because their constitution or pattern may be in big conflict with the drug, and it will aggravate their symptoms. So we don't think every drug works for every person in the same way. We're learning this in Western medicine, individualized medicine. Going back to Chinese medicine, I'll share with my style. So I trained in clinical hypnosis because Chinese medicine understands the importance of mind and mind body, but we were trained as barefoot doctors. We're past cultural Chinese revolution. So they stripped out the spirituality of Chinese medicine. We were really trained as basic doctors where it was very physical acupuncture. It wasn't until later that I learned to work with the emotions and spirit much more in my profession. But in the schools, we weren't trained that way. But I knew the importance because they talked about it. So I went and got another background in many energy psychology things, Psych K, more superior transformation, hypnosis, clinical hypnosis, Ericksonian hypnosis, EFT. I went and did stuff to work on that emotional level because Chinese medicine understands it's so important. I use low-level laser therapy. So I can stimulate an acupuncture point with my finger, acupressure, because I want to put information into that point and it has an action. So I can use my finger. I can use a needle, we call it acupuncture. I can use heat, we call it moxibustion. I can use photons, we call it laser acupuncture. So I can put a magnet on it. I don't know what they call that. I can use aromatherapy on an acupuncture point. I can use a tuning fork on an acupuncture point. I've never identified as like just an acupuncturist. I like the theory and the principles, and then I can incorporate anything into it. So I use sound in my clinic. I have a sound table, does vibration. Why do I like this? Because it bypasses the mind. It's perfect for what your book says. When I do conscious work, I'm working with your mind. So I have to get past your mental part, right? But when I use vibration, I bypass the mind. I'm going right to the cells. I'm going right to the nervous system. I'm skipping your head. So people are just lying there, and then next thing you know, they're like, whoa, what is this? They feel great. We bypass the mind. So I like sound. Sound is powerful. And Einstein said the future of medicine is going to be frequency medicine. And to me, that's like sound therapy, that's color therapy. So music, photons, all energy type medicines. So I use low-level laser therapy. I use it because a medical doctor that was a pain specialist, Oshiro out of Japan, accidentally helped two women who were already in menopause, early in their menopause days. Their menses came back, and it was an accident. He was working their back pain, but he had a technique to engage the parasympathetic. And he did this technique with the laser because if we can engage the parasympathetic, we'll create blood flow head to toe. And so if she had back pain, like in this case, he would do this technique around the neck. He would do vertebral artery, carotid, vagus nerve, stellate ganglia, and stellate plexus to create a parasympathetic response. Then he would go locally and do her back. When these two women had their cycles, they realized, hey, maybe we were helping rejuvenate the ovaries by bringing blood flow. So they did a study, and yes, in their study, they were able to increase pregnancy rates and live birth rates using low-level laser therapy. I use it always in my practice now because it creates blood flow. So there's circulation. Qi and blood flow together in Chinese medicine. So if I've improved circulation, then I must have improved qi flow and vice versa. And I use it because if I can get somebody in parasympathetic on my table, the body heals. You called it safety. So I'm always looking to create safety, both mind, body, spirit. Why? Because if you go into safety mode, the body starts to heal, always. If you're not safe, I can't do hypnosis on somebody who's not who's still in the frontal brain in the sympathetic mode because it's not ready to receive anything. Its goal is survival. But if I can take you out of beta into alpha theta, now your operating system is open to new programs to be imprinted. And so if I can answer your question, I use sound and laser therapy in my practice. I use hypnosis and energy psychology. Somebody gets on my table, in that 50-minute hour, I use whatever I need to use, and I bring in all kinds of tools through the NAC, and I'm that guy that's the process guy. After I read Eckhart Tolle's book, The Power of Now, I needed a how to now, and that's what I ended up developing for myself, and I share is how to now. And so I use all these tools to create safety, to create chi flow, to give you resilience and the capacity for your body to release and let go. And there's many ways to do this. There's no right way to do this or one way to do this.
Exactly. And being able to have multiple tools allows us to be that much more adaptable to that person and what they need and meeting their body where it's. So for those listening, this is why I joked with Dr. Lorne that he could have written my book for me because we really are saying the exact thing. And it's been wonderful. You say, the power of now, and you needed the how to now. There was like the power of feeling, just feeling your feelings. And I needed but how do I feel my feelings? I don't even know how to, because it felt that unsafe for me at that time in my life. I am going to completely use you and your time right now, Dr. Brown, in order to get some personal medical advice. This is why I host because I get to ask questions about myself. So I've been doing acupuncture for years, and I get acupuncture, I would say, at least once a month. And if I'm doing a lot of expansion and stress, then I'm in there more often. And there's always been this thing, I'm sure you'll have a language better than thing, around my solar plexus. And I've had chronic digestive issues since I was a girl. My acupuncturist started me on the moxa and using moxibustion. And so I will put one over that solar plexus area and then another one, a second one at the same time on my lower spine. It is like magic for my body. Why? What is, help me understand.
If you have, for one thing, if you have cold in your digestive system, right, and in your kidney system, the lower down, cold contracts and then the chi does not flow, right? And we talked about how much chi flow helps with health, circulation, emotions. And so moxa dispels cold, right? And it's tonifying. And so people often with digestive issues, not all, but there could be a component of both deficiency of the spleen system. It doesn't mean your Western spleen, it's just how it translates into English, can be affected. And then that shows up as bloating, could have constipation or diarrhea. Just, you know, the spleen, the yi in Chinese medicine, that mental emotional component is over worry, overthinking. So if it's out of balance, they're going to be the worrier or pensive person. And if you're somebody who's always thinking, so you go to med school, maybe you do write a book, you have a busy practice, you will, that affects the spleen. Too little is too little, too much is too much. Study is good, too much study can damage it. Sweet, light sweetness is good for the spleen. A full sugar diet will damage the spleen. So the herbs tend to have a bit of sweetness to them. They're a little bit more blander or sweeter. But if you went on a sugar diet, that would destroy the spleen and create more dampness. So mucus in your stool, heaviness in your legs, it goes into the mind, the brain fog, vaginal discharge. These are things, spleen, bloating, gas, because your digestion's not working. So dispelling the cold, but also moxa has a tonifying effect. And so it's going to support those organ systems that you add moxa to. And they're most commonly added to the spleen and stomach system and the kidney system. Those are the most common points that we do, but we can do them all over the body, different points on the body. And some people just do moxa in their practice.
Is it safe for me to do every day?
No, not that it's not safe. I just think it's okay for the body to not do something. So too little is too little, too much is too much. Just like low-level laser therapy. My patients who buy the home systems don't use it every day. It's like you got to give the body a chance to take the information and do something with it. And it doesn't, even supplements, by the way, people Monday to Friday and then drugs are different, but supplements, Monday to Friday, take off the weekend. Like, it's okay for the body to just have a little break for things that are supportive, that are food grade, right? Exercise. Would you exercise every day, or is it good to have a day off for that muscle? So it's not that you would cause major harm. You just may not get as much benefit if you keep giving the moxa, in theory. So it's okay to have, and again, it depends on the individual and what their condition is. Some people maybe every day for 30 days. But then it may spread out after. So it depends. Like with my pain and injuries, when somebody comes in for laser therapy, I will give them laser 5 days in a row, but then I start to spread it apart versus coming in once a week. If somebody comes in with an acute injury or a chronic injury and I start out once a week, I'm probably never going to get the momentum to get that healing response happening to give them relief. But if I see them 3 times a week for 2 weeks, then I can start going once a week after those 2 weeks usually, because I got the momentum going. And remember, it's not my laser doing the healing, it's your body. I'm just giving your body the information and the environment it needs to heal. So I would say, in general, very few things you need to do every day except breathe.
And sleep.
But you can survive a day without sleep, but you can't survive a day without breathing.
This is true. I'm not sure that I could survive a day without sleeping anymore. Last question for you as we finish up. What would be something that you would want them to know about these principles and intersecting with the biology of trauma?
I would say, again, keep learning as we're doing and do your work, because I have to say the NAC, I want to just, if I dance around to get to your answer, when I read your book, and I think I shared this with you, this NAC process is something that I just realized that all the people that are doing good work are doing NAC. When I looked at Tara Bach, Radical Acceptance, Eckhart Tolle, when I started Bruce Lipton, all these people, I started realizing they're doing Notice, Accept, Choose Again. Some have 10 steps, some have 2 steps. At the end of the day, it was Notice, Accept, Choose Again. So there is a way for healing. And I would say that what helped me with my patients the most is when I started to really do the process work and do my healing. Because there was a period of time where I could talk the talk, and I read all the books and all the self-help books, and I could talk it, and I was a great actor, but inside I wasn't doing very well. And some people got well, but I did really good. You can become enlightened from an unenlightened master is what I learned. But I would say that the joy in my practice, because I burnt out one, where the burnout went away, is when I started doing this work for me first, where I found people to help me, people like you, right? When I started doing and developing these tools, it's easier to walk a patient if you've walked that path too, right? And so one thing is I would focus on yourself as a healer, and Chinese medicine talks about that. You got to look into the eyes of the patient, the soul, and a lot of where your chi's at is going to impact their level of success in treatment. So one is do your stuff. And then my podcast, my blog, I'm putting out more on my new website on this NAC because I think I distilled things down really simple. I'm that left brain guy, used to be a CPA, that needed a little doing to get into being. Because I was never the person that could just sit on a couch. Some would say I might have had ADHD as a young kid and an adult. It served me well. But to sit on a cushion wasn't good, and to try to quiet my mind. I added more resistance to the field. Learning some doing to get into being, what I realized is these little doings were actually and releasings. And it got me to being. And if my CPA brain and my little hyperactive mind can get to these states and really tap in, then I feel like anybody can. And so if you're able to sit and quiet your mind, you're good, because that's the goal. Sit and quiet the mind, go safe. If you need some how-tos to get you into the being, I would recommend looking into the NAC, because any tool, EMDR, EFT, Psych-K, any tool can fall into it, because it's not a dogma, it's a structure. So I would invite people to check out our episode on the podcast. And I basically would really say, read your book a couple of times. It's all here.
Thank you. And I loved our conversation. So yes, please go subscribe to his podcast, listen to the episode that we did together. It was fantastic. Final message that you would want to leave my audience, Dr. Lorne?
Yeah, stay curious and be kind to yourself. That's it. If you can stay curious and be kind to yourself, it's going to be gold. It's going to be golden for you. Stay curious, be kind. That creates safety, by the way. If you're curious and kind to yourself, have that compassion, then it's all good. That would be my simple message.
Thank you so much. Thank you so much for your time. Thank you so much for your work, decades of work, and very much appreciate you coming on to share with us today.
Thank you for having me on. I feel privileged to be able to talk to you and be on with your audience. And again, thank you for writing your beautiful book. I really appreciate that.
Amazing. Thank you again, Dr. Lorne. Where can people find you?
So if you want to read blogs on Notice, Accept, Choose Again, different than the N-acetylcysteine that Aimie and I both love to take and provide, but the NAC, Notice, Accept, Choose Again, I have blogs on Acubalance, there's that. And then the Conscious Fertility Podcast, those are two great places. My lornebrown.com website it's old, but in January, it's relaunching all about this work. That's all it's going to be about. So if you check out the Lorne Brown or Acubalance, you'll find tons of information. I do telehealth for people outside of Vancouver. Obviously, I love using my laser needles. So if you're in person, I love doing that.
All right. Thank you. Thank you all. Lots of love. I loved this conversation with Dr. Brown because it highlights something I see quite often. When symptoms surface, especially during a time like perimenopause, those symptoms aren't actually our body falling apart. They are information, and they reveal what we've been holding on to all along, and it's now asking for healing. When we shift from asking, why is this happening, to what is my body showing me? We can step out of shame and into partnership with our body and biology. From that place, our system has room to retrain its patterns and to deepen its capacity as it experiences safety on a whole new level. If you leave with one thing today, let it be this: your symptoms are signals of what needs supporting, not shaming. If this episode resonated, you'll want to check out episode 56 on hormones, a portal into our stored trauma, episode 23, like I mentioned at the beginning, on the parasympathetic state, or episode 74 with Peter Levine on why stored traumas become syndromes. I'm here to save you time and money by bringing you practical information that will help you accelerate the healing journey, whether for yourself or for those that you help. Would you please leave a review right now of the podcast, whether you're listening or on YouTube? Your feedback helps me bring you great content and helps others find the information that could change their life as well. I'm your host, Dr. Aimie. Until next episode, lots of love.